Hello, everyone, and welcome to the inaugural webinar in the Institute for Health Policy Studies series entitled How to Impact Policy Change. And I want to thank all of you for joining us on behalf of myself and my colleague, Dr. Beth Griffiths. This first webinar is entitled Impacting Policy 101. And so you can think of this as sort of a 30,000 foot overview of the policy process where Beth will start with sort of thinking about how you map the policy landscape and reviewing the legislative process. I'll then talk about administrative, judicial, and budget processes. Then we're each going to share some case studies from our own experiences impacting policy before we turn it over to you for questions and answers. But before we do any of that, we want to introduce you to ourselves in this series. So I am on the faculty at the Institute for Health Policy Studies, Family and Community Medicine, and Health Force Center. I have a PhD in health services research, as well as a master's degree in public policy. And most of my research is on the health workforce, insurance benefit mandates, and access to care for vulnerable populations. And I also co-direct the Master of Science in Health Policy and Law. Beth?
Hi, everyone. I'm Beth Griffiths, and I'm on the faculty in the Division of General Internal Medicine and core faculty with IHPS. Really grateful to everyone for joining us today. And as far as how I spend my time, I spend about half my time seeing patients as a primary care doctor and working with residents and medical students clinically. And then I spend the other half of my time collaborating with Janet and other researchers in terms of translating your findings into policy change, and then also teaching medical students, residents, and faculty in the spaces of health policy, advocacy, and community engagement.
Thank you very much, Beth. And just a little about our roles as co-associate directors of policy programs at IHPS. Our overarching goals are to train faculty, staff, and trainees to engage effectively with the policy process. And to connect faculty, staff, and trainees with policymakers and to help you collaborate with other groups across campus and UC-wide that are engaged in policy making. This slide gives you an overview of the How to Impact Policy Change series. This is indeed our kickoff webinar. Next month in April, we'll feature Molly Ann Brody, Vice President and Chief Operating Officer of the Kaiser Family Foundation, who will talk about how to be a resource to journalists. We'll have webinars in May and June as well. Then we're going to hit the pause button for the remainder of the summer. And then in the fall, depending on COVID, we hope to offer in-person workshops, probably about 2, that will enable you to dive more deeply into building some of these skills and that will be more interactive. With that, I think I will turn it over to Beth to talk about mapping the policy landscape.
Wonderful. Thank you, Janet. So I'm going to start by talking a little bit about mapping the policy landscape. And the first question that I always ask myself in that space is really, at what level of government do you want to try to impact change? And so some of that is going to be determined by your area of interest and who has the ability to impact that. So for example, Medicare is a federal program. And so if you want to impact Medicare, you're really primarily going to need to work at the federal level. Medicaid is a joint federal and state partnership, and so you have opportunities there to work at multiple different levels, and we'll talk about how to choose among them in a second. And then really many social services and mental health services are determined primarily by counties, and so that can actually be a very exciting opportunity to work at a local level. When there are multiple options in terms of levels of influence, I'll often start by asking myself, who's currently in that role and are they likely to agree with you? But then also, do they have the ability to really make change? And I often encourage people that the federal level is challenging, especially now. It's always been challenging. But if you have the opportunity to work at multiple different levels, it's often easiest to have an impact at a local and then state level, where sometimes not as many people are involved, but also the process, at least right now, tends to be a little bit more responsive than everything going on at the federal level. Not to say that you won't work at the federal level too, but when there's options, to think about that. And then as you're starting to think about who you might actually want to go and talk with, and whether they might be in agreement or whether they might be able to impact the policy that you're interested in, the first question I always ask myself are, who are your local elected officials? And maybe you know that already, or maybe you don't, but I think it's really important to find that out. There's a lot of different ways to go about that. I like this particular website for people who are in San Francisco, just because it goes from the really hyper local on individual sort of local commissions all the way up to the federal level. Sometimes the local piece is a little bit harder to find. So they also do a nice sort of map of San Francisco and help you figure things out that way. And then beyond that, asking yourself who serves on and chairs key committees. All of that is quite available just through a Google search. For example, there you see all the different members of different assembly committees in the state, but you can do it at multiple different levels. So important to know. On the left there, you see Phil Ting, who is one of our local assembly members here in San Francisco, and he chairs the budget committee. So you want to know that before you're going to meet with him. You want to know that he's going to be really busy during budget season, which we'll talk about when that is in a bit. And you want to know that he really does have a lot of power in determining the budget process. And then also asking yourself who serves in a leadership role. So obviously there we see Nancy Pelosi, who is our local representative here in San Francisco, but then also obviously serves as speaker. And so is really thinking about the national picture, not just what's happening here locally. And that can be a fantastic opportunity for us to both be constituents who she should really be listening to, but then also obviously she has a lot of people to listen to. And so it can sometimes make it a little bit more challenging to get a hold of her. And then really thinking about what contacts you have with people. And this is where it's so important to be part of a coalition, never to try to change policy alone. This comes up a lot also in San Francisco. We tend to be pretty homogenous politically. And so sometimes our local representatives are people that are going to, you're going to be preaching to the choir, assuming you share the majority political view here in San Francisco. But when you're thinking about swing votes, we don't tend to have the swing votes here. And so being in coalition with people that are in more swing areas can be incredibly helpful. And then when you're starting to actually think about going to meet with people or deciding who you're going to meet with, I try to do some background research on them as well. So I will quite frankly use a combination of Google and Wikipedia and their official website, and then I'll try to go to newspapers as well. The reason I do that is that you want to see both how they project themselves, what they're proud of, what they say are their priorities, and you might want to see any controversies that they're involved with, which obviously are not going to be on their official website. So for the questions of what party affiliation they have, what district they represent, how long they've been in that position, what jobs or positions they have before, you can often find that either way through their official website or through Google or Wikipedia. In a news search. You can also find usually on their official website what committees they serve on and if they have any leadership positions, which is so important. You can also on their website oftentimes find if they've sponsored any legislation in the past 2 years that might be related to your issue. We'll talk about how to find their votes on other issues in a moment, but key sponsored legislation and what they're proud of, you'll see on their website. And then sometimes I find myself hitting more resistance than I would expect. And sometimes the answer to that is donors. And so I will actually go and look and see, for example, the Secretary of State website in California lists all the donors that are publicly available. And I search from highest donation amount to lowest and sort of see where they're getting their money. Not to say that that's necessarily driving everything they do, but clearly it can have some influence. So as far as actually tracking your legislation, my favorite website is the California State website, although we'll talk about local and federal too. The website address is there. You can also just Google California Leg Info and it will pop up. It's a fantastic resource if you already know the bill number. If you're trying to figure out if there's legislation on your issue, it's a little less great for that. There is a keyword search. However, that keyword search it is really exact language. So for example, if you're working on overdose prevention sites, which have also been called safe consumption sites or safe injection sites, and you search overdose prevention sites, and what's listed there as safe consumption sites, it won't necessarily tell you. So as far as finding legislation, I'll use LegInfo, but I'll also supplement with other sources, like some of the various policy think tanks and working with coalition members and things like that, as well as sort of a newspaper search. But if you have a bill number, this is the perfect place to go. And so what you get when you search that is the actual text of the bill, which can be helpful, but honestly, I don't use very much. It's a little bit dense sometimes. And then you'll get the history of where it is winding its way through the legislative process, which we'll talk about in a moment, as well as where it is right now. You can also find all the votes that have been taken on it, which is so important. So for example, if you're going to meet with Assemblymember Ting about a particular issue, you want to know if he's taken a vote already. You can still meet with him if he hasn't taken a vote. If he has taken a vote in your that you are happy with, you can thank him for it and talk about how you can be helpful going forward. If he has taken a vote you're opposed with, obviously you can go and try to change his mind, but you don't want to walk into the meeting not knowing if he's already taken a vote. So that's where LegInfo comes in really helpful. There are also bill analyses that are written by committee consultants. And these are, for me, probably the most helpful resource. They are, in theory, at least nonpartisan, although Democrats have held the majority in the California legislature for a long time, and so the staff tends to lean that way. But all the analyses will include both sides of the issue, what the supporters are saying, what the opponents are saying. And they also talk about the different stakeholders as well as some fiscal analysis, which is just so important to have before you head into any meeting. At a federal level, congress.gov is sort of the official corresponding website, but it's quite frankly hard to use. It's hard enough to use that the US government actually decided to try to make a better, more friendly website. And that's how govtrack.us came into being. This is what you see here. I use it more than the congress.gov, although you can link to congress.gov too. But it provides a helpful summary. It talks about who the sponsors are, what the status of the bill is. At a federal level, the vast majority of things go nowhere. And so I really recommend to people this website because it has this prognosis. You'll see there like 3% chance of being enacted, and that's pretty typical. Most things have a really low chance of being enacted. You can also see the full text, but quite frankly, it is the densest at the federal level, so I don't really recommend that very much. And then at the San Francisco level, there is also a similar website for the Board of Supervisors. Unfortunately, it does not have analyses, probably just due to limitations on staffing, but you can see the actual text, which is of all the levels, the most digestible. You can see the sponsors, which you want to know already if they're in support or opposition. You can see votes that have been taken. And you can see public comment as well, which is helpful if you're looking for coalition partners or to see some stakeholder mapping. Now, let's say that you want to get involved in an issue area. I'll take, for example, integrating primary care with behavioral health. And you don't have a particular bill number that you know of yet, but you want to know what's happening in that space. That's where I'll often go to some of the foundations, the think tanks, and really look at some reports that are great at getting you up to speed. Now, if you're already an expert in this particular area, you may not need it, but for many of us, we may have a really narrow area of interest or have deep research in an area, but we don't know the whole policy landscape in an area. And this is where these reports are so helpful. I always tell people you want to know something about the think tank before you start to go read materials from them. This is less of an issue in California, but at a DC level, many of the think tanks have a partisan bent, and that's fine to still use them, but you want to be aware of that before you're going and looking at their reports. As far as a few examples, here in California, I know many of us are familiar with the California Healthcare Foundation, which has fantastic reports on healthcare issues and broader health issues in California. The California Endowment and PPIC are broader still in their scope, and I find their reports really helpful if you're looking at issues that are not so directly related to health. The Kaiser Family Foundation, we will have Molly Ann Brody from the Kaiser Family Foundation joining us next time. But I find their reports at a national level on health issues just incredibly helpful to get up to speed. For focus on reproductive health, the Guttmacher Institute is really helpful. For a focus on international examples and comparing across different countries, the Commonwealth Fund is really helpful as well. So I want to turn now to talking a little bit about stakeholder mapping. So thinking not just about policymakers, but also about the various stakeholders and interest groups. And the first question, of course, to ask yourself, I oftentimes start by not actually researching this, but just imagining in my mind and then going and verifying afterwards. So do the various groups who might have an interest in this, do they support you or not? And then how powerful are they? And the how powerful are they question, I think actually has two dimensions. One is how powerful are they as an organization, but then also how much do they care about your issue? Because, for example, many of the professional societies can be quite powerful, but if your issue is priority number 50 for them, they're not going to put a lot of weight behind it. And so they may not actually be as powerful on your issue. And then I always ask myself, could I neutralize opposition or gain support? Sometimes if you're funding things in a particular way, if you can fund them in a different way, I'll talk about that in the case study, but that will neutralize some opposition oftentimes. So as far as actually verifying it, I will first, particularly if you have a bill number, go to LegInfo in California. There are similar resources at a local and federal level. But the bill analysis will list all official registered support and opposition. This is an example from a Safe Consumption Site bill this year, at least partial lists. And then you can really get a sense of how to map these stakeholders. You can see who's officially on various different sides. And then when you look at co-sponsors, if you're in support, that's oftentimes a really good group to reach out to learn more about how you can get involved and what the landscape is looking like. So I'm going to turn now to talking a little bit about the legislative process. So this is examples from a state level, but the state and federal level is both bicameral. So at least in theory, they work in a similar way, although we'll talk, the practicalities are a bit different. So a bill is introduced in one house, it first goes to committee hearings and then to floor votes and action, and then goes over to the other house and goes through the same process. If changes were made in the second house, it has to go back to the first house just for a floor vote for what's called concurrence and amendments. If there were not significant changes, it will go straight to the governor or the president for either a signing or a veto. On the right there, you see an example. SB 562 was a single payer bill a couple years ago. And you can see from LegInfo what you get when you look at the status. It's a little bit unwieldy, but if you take a moment, you start at the bottom and you look through, you can see where it's gotten referred to, you can see the votes, and you can see when it's set for hearing. So I use that to see where things are at, but also sometimes to see when a hearing is set, if you want to go and make public comment. Oftentimes they don't post it very far in advance. And so if you are involved in a coalition or you have contacts in the legislature, sometimes you can learn a little bit earlier when it's likely to be heard. So I want to take a moment to talk about the legislative calendar. This is in Sacramento, and Janet will talk about in the budget process, they haven't always stuck to these deadlines, but right now they are really sticking to these deadlines. And so there is a very clear calendar process. It's a 2-year legislative cycle that begins in January and really initially focuses on policy committees. And then really the middle of May through the end of June is quite focused on the budget process, which Janet will talk more about. And then in July and August is an incredibly busy time trying to get all the bills through the legislature before the legislature recesses at the end of August or the beginning of September. At the first year of the cycle, bills can continue if they haven't made all the way through to the next year. But if it's the end of the 2-year cycle, there is a hard deadline at the end of August at midnight, and bills will die and have to start all over again if they can't make it through the process. And then in the fall, people are back in their districts. Sometimes they're campaigning if it's a campaign year, otherwise they're back with their constituents. It's an easier time. And if you're there to talk about new ideas or to just get to know people or to do educational events, that is the time to go and talk. People love to talk with you then. If you come with a new idea in July, nobody wants wants to talk to you. And so really knowing that cycle is so important to being effective. In the DC level, ironically, it's the Wild West there. There's no real calendar equivalent to Sacramento's. They meet year round. The leadership determines when the recesses are, which is typically the month of August and over December holidays. There's no set timeline or deadline. I checked in with a friend who's a longtime Washington staffer to make sure I wasn't missing anything. And she said, nope, basically no deadlines, no set calendar, no schedule. Committees only need to give 48 hours notice prior to a hearing or markup. Same with floor votes. So you see there's a lot more sort of leadership control. All right, so I am going to stop there and turn it over to Janet to pick up from here.
Okay, thank you very much, Beth. While I'm getting my part of the slide deck up for you, a couple things. One, thanks to those of you who have put your questions in the chat. I did answer one, which is yes, the webinar is being recorded and it will be available to UCSF faculty, staff, and trainees. We do request that you keep this internal to UCSF at the request of some of the speakers in this series. And want to encourage you, please do keep putting those questions in the chat, the question and answer forum, not using chat, question and answer forum. Please put them in there and we will answer them at the end. So thank you much. So now Beth's going to, I think, a great overview of the legislative process. I'm now going to talk about administrative judicial processes. And then a separate section, budget really is both an administrative and a legislative process, but it is its own sort of beast, if you will. And I also want to kind of give you some important factual information that I think is relevant should you choose to become engaged in advocacy around the budget. So why do administrative processes or executive branch processes matter? Well, they matter tremendously because enacting legislation is only the first step. If you really want to implement policy change, there's some additional steps. And the second and most important set of steps occur in the executive branch. So once the bill is enacted, the legislature really shifts to the legislative branch to implement it. And in some cases, depending on the complexity of the legislation and depending on how the legislation is written, the executive branch will issue regulations to implement. And so we see this a lot in the environmental area. We'll see this with Centers for Medicare and Medicaid Services on changes in payment policies, programs like the readmission penalties or incentive changes and other changes. California, the development of regulations is governed by the California Administrative Procedures Act. And that act sets forth two processes for rulemaking, and rulemaking is a synonym for regulations: regular rulemaking and emergency rulemaking. I'm going to walk you through the regular rulemaking process because that's the one that's most frequently used. And so this diagram, we want to start up at the upper left, and that is where the legislature leaves off. It's granted authority to adopt regulations. Bill's been signed by the governor. So then the bill goes to the state agency, and the state agency does a lot of work to get ready to issue preliminary regulations. It's going to issue a notice of proposed rulemaking, a statement of reasons for why it's doing it, and then the text of the regulations. And so once all that's ready to go and the notice of open rulemaking is issued, a 45-day clock starts. And so there's a 45-day period for the public to make comments. Sometimes the agency will hold a public hearing. Often it will just ask for written comments. And so this is certainly a time, if this is an issue you care about, a piece of legislation you care about, for you to make comments. And so at the end of that 45-day period, the staff of the executive branch agency will review all the comments and decide how it wants to respond to them. Sometimes there will be no changes or very minor changes, and the agency will proceed to make a final statement of reasons, a summary of responses to comments, and issue the final text of the regulations. Often, though, in response to the comments, the agency will make some changes in the regulations. Some of those are major, some not so major. Depending on whether the agency believes the changes are major, there will either be another 45-day clock, or if the agency says they're really not quite major, there'll be a 15-day clock for comment period. And so these are opportunities for additional comments before they issue the final regulations. If you want to track upcoming regulations, proposed regulations that are going to be issued, you can go to the website of the California Office of Administrative Law and their section on California regulatory notice registers. Now, unfortunately, this isn't a searchable database, so you kind of have to keep coming back to look to see if regulations on your bill have been issued, but at least it's a place you can find those proposed regulations, review them, and decide whether you want to comment. At the federal level, which is what's displayed on this diagram, the process is very similar. I think the only major difference is when the federal government issues a notice of proposed rulemaking and draft regulations, the minimum public comment period is 30 days instead of 45 days. So it's a little tighter on the federal side. To track federal regulations, you want to go to a site called regulations.gov. And here I've just taken a screenshot of one example of a regulation that's currently pending. This is something issued by the Centers for Medicare and Medicaid Services on January 11th of 2022. And it concerns policy and technical changes to Medicare Advantage and fee-for-service Medicare prescription drug benefit programs. And what you can see here is there's a box for comments. So you can actually go and type comments right into the website, or you can, say, write your comments out in a Word document and copy and paste. You'll find here also the proposed regulations, other pertinent documents. And if you see in this button, browse posted comments, you can browse and look through comments that other people and other organizations have written. So you can get a feel for what the agency is hearing from other interested stakeholders. And so this is an opportunity, for you to either share your technical expertise based on your research, or perhaps expertise you've acquired as a clinician in, how these something like the Medicare program works in practice at UCSF. I'm going to turn now to judicial processes, and these matter because opponents of laws and regulations can challenge them in court. And we've seen this over and over again with the Affordable Care Act. We're seeing right now some really big changes around reproductive health. And in general, if for state laws, cases are typically adjudicated through the state courts. So state laws, state courts; federal laws, federal courts. Something like the new state laws on reproductive health kind of cross the boundaries, and that's because the cases are about whether these state laws violate the Supreme Court's ruling in Roe v. Wade. And so remains to be seen how the Supreme Court will rule there. You can track opinions in court cases. And what I've done here is pointed you to taking a screenshot of the supremecourt.gov website. This is where you find Supreme Court opinions. And these are organized by year. I just pulled out 2021 here to give you an example. That's the last full session. I mean, we have a session right now, but the Supreme Court sessions typically don't end until June. So 2021 was the last full session. So if you open this and scroll down, you would see a list of opinions, including this one, which is the Supreme Court opinion in California versus Texas, the last case about the Affordable Care Act. So you could download this PDF and read it if you were interested in understanding how the Supreme Court ruled and the rationale for the ruling. I'm going to move on now to the budget process. And local, state, and federal governments develop budgets to allocate resources for all the services they provide. And budget processes and actions become particularly important in times like those we find ourselves in California this year. We have a pretty significant budget surplus this year, as we did last year. And so a lot of the activity in Sacramento right now has to do with how that budget surplus is going to be allocated. How much of it is going to go to rainy day fund? How much of it is going to go to health, to homelessness, environment, all sorts of things. So there's as much action on budget as there is on legislation. That said, laws govern the extent to which elected officials have latitude to determine how resources are allocated. And at the federal level, spending for some programs, which are often referred to as entitlement programs, is mandatory, meaning spending in on those programs is based on formulas enshrined in statute. And so you can't really change spending on them in the annual budget process. You need to go through the legislative process that Beth described earlier to make changes. And as you'll see on this slide, mandatory spending encompasses over half of the federal budget, 61% in fiscal year 2019 to be exact. And then, so that, again, annual budget process doesn't touch mandatory spending. Also doesn't really affect what we spend on interest on the national debt. The way in which Congress, and the president get engaged on interest is raising the debt ceiling, something that's been in the news a lot of late. So really in the annual budget process at the federal level, the action is in that 30% that's discretionary spending. What programs are mandatory and which are discretionary, you might ask? Well, this pie chart breaks that down, and over mandatory programs, which are over primarily on the right side, we'll see that those are primarily Social Security, Medicare, and Medicaid, CHIP, and Affordable Care Act subsidies. So the subsidies for covered California and the exchanges at the federal level and in other states. So think about this, 26% of the federal budget goes to health insurance programs, Medicare, Medicaid, CHIP, ACA. So that's over 1 in 4 federal dollars going to health insurance. Another 23%, almost 1 in 4 dollars, goes to Social Security. And now Social Security is not an insurance firm. It doesn't directly pay for healthcare services, but what it does is provide income security for senior citizens. And it's arguably been as important as Medicare in improving the health and well-being of seniors. And then we move over to the left side of the pie chart to discretionary spending. We see that's divided pretty evenly between defense and non-defense discretionary. And so what is that 15% of spending that's non-defense discretionary? What's a whole bunch of things? It's the NIH, it's the Health Resources and Services Administration, which funds things like community health centers, maternal child health, HIV care. It's housing, it's agriculture, it's transportation, it's energy, a whole bunch of stuff. So the point I want to make here is that there are lots and lots of interests competing for that 15% of the federal budget that goes to non-defense discretionary spending. This slide shows an ideal timeline for the federal budget. I say ideal because the budget process, much like the legislative process at the federal level, has become the wild, wild west. To be fair, the president usually submits the budget proposal to Congress more or less on time, and Congress usually at some point in the spring gets around to adopting a budget resolution. But the appropriations process, I think many would argue, of late has gone completely off the rails. We typically do not have a full final federal budget on October 1st, the beginning of the new fiscal year. And so when you hear about these continuing resolutions, when you hear about potential government shutdowns, what's behind this is this failure to enact the appropriations bills in a timely fashion. Now, here in California, as Beth said, things have become a little more stable and more predictable, partly both in the legislative process, and especially in the budget process. And there are a couple of reasons for this. In the late aughts, legislation was passed that repealed the 2/3 majority requirement for the state budget. So for quite a while, we had to get a 2/3 majority of legislators to agree on the state budget. And that led to a number of years in which state employees didn't know whether they were going to get paid in July and August, and sometimes didn't get paid and had to get emergency loans. So with the change back to a simple majority, we've been able to get the budget passed in June. There were also provisions passed at that time that would dock state legislators' pay if they didn't get it done in June. So having said all of that, the process for the budget, is a little different from the legislative process. Legislative cycle is sort of January to December. Budget cycle is August to July. And so in the fall, the state agencies, the Department of Finance, and the governor work to develop the governor's budget. And simultaneously, on a separate track, the leaders of the state legislature, both the Assembly and Senate, develop budget priorities. So this is a good time in the fall, just as it's a good time to sort of meet and greet and talk about legislative ideas, it's a good time to talk about budget ideas. Then in January, the governor releases his proposed budget. February through April, the budget committees and subcommittees in the state legislature hold hearings, both on what the governor's proposed and their own proposals. Excuse me a minute. And then in May, something comes out that's colloquially known as the May Revise. And that's the May revision to the governor's budget. And that, is based on updated estimates of revenues, any new thinking the governor has about spending. And so that comes out, and then the Assembly and the Senate review that. They review their own priorities. They finalize their budget proposals as for their own versions. So we've got 3 versions: governor, Assembly, Senate. And then in June, legislature passes the budget bill and trailer bills, and a new fiscal year begins. I'm going to close with this slide to sort of give you a sense of how dollars are allocated in California. And so in 2021-22, that's the last budget enacted last summer, $258 billion in the state budget, of which 33% went to health and human services. And note that this $258 billion does not include $198 billion in federal funds for health, human services, and unemployment insurance and other purposes. The bulk of those federal funds, and indeed the bulk of the state funds for health and human services, go to the Medi-Cal program. Medi-Cal is a program that's jointly funded by the federal and state government. And due to the Medicaid expansion under the ACA, has grown to cover, I think, about 1 in 3 or certainly 1 in 4 Californians. So it's quite a big program, dwarfs everything else. I'm going to stop there. Apologies that I'm having some sort of frog in my throat, but we're going to let me stop sharing the slides. What we're going to do next is just share a couple examples, Beth and I, from my work and Beth's work, on how we have impacted policy. So Beth, if you want to take it away.
Sure. Thank you, Janet. So Jen and I have actually both done work on workforce issues, but from different vantage points. And I think they illustrate some of the different opportunities for people who are policy-oriented researchers, for people who are clinicians, for people who are in training or educators. And so I'll start with mine, and then Janet will share her story as well. So I've been involved in trying to increase funding for primary care residency slots in California since I was a medical student. And I sort of began the role partly working with professional societies, as well as some folks at UC and more grassroots coalitions as well. And I was sort of the medical student that they would put up to talk at committee hearings about why it was so important that we were building medical schools, but oftentimes policymakers didn't even realize that you could build all these medical schools, but if you didn't have residency slots, that people would leave the state and may not come back. And so oftentimes it was sort of the importance of a personal story as a medical student who was afraid I wouldn't be able to stay in California, and working in coalition with other medical students and residents as well. And it began really, they were lean times. And so the challenge, everyone agreed that with the ACA being passed, we really need to do a lot more work in terms of workforce issues. But the challenge was how are we going to pay for it? And we were pretty much told year after year that the state was not going to fund it beyond the small amount they were already spending. So we were looking for different ways to fund it. And as you might imagine, the opposition always came from whoever was going to be asked to fund it. So we tried increasing doctors' licensing fees and got some opposition from the doctors' groups there. We tried having insurers pay for it. Of course, got some opposition from the insurers. There are several different things. And then ultimately through that process and going to different committee hearings and sort of failing a couple times, I got to know a budget committee consultant who got pretty passionate about the issue and was able to actually find a small pot of money that was allocated but wasn't being used for anything. And so that's how we first actually increased the funding just a little bit, I should say it's a couple $1 million, but in terms of the whole state budget. And so that was, I think, a really exciting win that came from persistence, I would say, and also being part of a coalition and then forming relationships with people over time, which I think are some of the really key lessons. And then sort of realized in California, propositions are a big way that things get done and things get funded. And so became part of a group that worked on Prop 56, which was a tobacco tax that increased funding for workforce issues as well as Medi-Cal reimbursement rates. And one thing I'll say in that process is you think you win and it's fantastic, you won, but still year after year, we had to go back as there were sort of talk about moving the funding elsewhere to do other things. And the same coalition often has sort of kept itself together working on these issues, which has been fun. And then lastly, most recently, since I've finished training and been on faculty a couple of years ago, at the very beginning of the COVID pandemic, which, oh my goodness, to say a couple of years ago at the beginning of the COVID pandemic makes you realize how long this has been going on. But we thought, it didn't turn out to be the case, but the governor projected we were going to have a huge deficit in the state. And so they were really looking to cut funding in lots of different areas. And one of the things that was funded was that was threatened to be cut by Governor Newsom was the Song Brown program, which is one of the programs that funds primary care residency slots as well as other things. And so what I was just totally inspired by was that a group of residents here at UCSF really went and said, like, we can't allow this to happen. And so the support I provided them was actually just some of the things I've talked about in this talk, which was letting them know the timeline and making sure they knew who's on the budget committees and the budget subcommittees. And then they got in touch with people they knew kind of across the state and ended up just making calls. I think oftentimes people feel like making a call or sending an email is not all that important. But what I can tell you is that just through sort of working with different residents and program directors across the state, they ended up calling in, and it was the #1 called about issue that year, according to the person I know who's works in the legislature. And I will say without a doubt that they were quite certain that part of the reason why that was prioritized to be kept was that they had heard so much about it in the process. Now, of course, one can debate whether it's, whether having priorities be made based on the number of people who call is a good thing or not, but we are, if that's part of the point of a democracy is to be responsive to people. So I often say, if you're not at the table, you're on the menu. Everyone has probably heard that, but it doesn't take a lot. And I think the message I want to leave people with is that hearing from people who are really impacted or have expertise on issues, it matters. And particularly when different priorities are being considered, it does matter. So I'll turn it over to Janet now.
Okay, thank you very much, Beth. And I'll try to be be quick. I'm going to pick up first on some of the first things Beth said, which about her work on funding for residency training and Proposition 56. I've been on that issue and on a lot of issues a little more behind the scenes. I sometimes do testify, but mostly, the work that I do is to draw upon the research that I and my colleagues at Health Force do and try to translate that for policymakers. And so, we have been the folks that have been documenting shortages of primary care providers, geographic maldistribution, sharing information that helps make the case for why increasing funding for residents in California matters. We also, coincidentally, Beth doesn't even know this. Just yesterday, I had contact with the folks at Physicians for Healthy California who administer the Prop 56 funded funding for residency training through something called CalMedForce. And, the email went like this, Janet, we've been using this one criterion to identify the counties in which our applicants for funding are located as medically underserved. And, there's some ways in which the results seem a little strange to us. Can you explain it? And also, Janet, are this the one, should we really only be looking at this one indicator? And so I was able to say, well, okay, here's what I think is a little funky about some of the data on the rural counties. And by the way, we can get you some more updated data, but there are other ways to also think about what's underserved, looking at, as they were at ratios of primary care providers to other physicians to population. That's important, but you can also, look more broadly around health status indicators, social determinants of health. And so that's just like one really concrete example of being a resource to folks, in this case, folks who are implementing policy. I also do a lot of work directly for the legislature to inform their deliberations on bills. I'm part of something called the California Health Benefits Review Program. It's coincidentally celebrating its 20th anniversary this year. Some ways that makes me excited, some ways it makes me feel old, but nonetheless, the California Health Benefits Review Program is established, authorized under legislation, funded by health plans. And our team, which is led by a small group of staff at UC Berkeley and encompasses faculty, staff, and trainees at 6 campuses, produces reports for the state legislature on health insurance benefit mandate bills. Benefit mandate bills are those bills that require health plans to cover a particular treatment, it could be medication, device, require them to cover a provider, bills that affect terms and conditions of coverage. Our team at UCSF, we do rapid cycle lit reviews to tell the legislature what evidence is out there about whether this treatment, this provider is, effective. Are these services that, have beneficial outcomes on the health of individuals? Other folks on other campuses look at impacts on utilization, cost of health insurance, and broader public health impacts. We do these reports, we work on them from February through April on a 60-day timeline. Yes, lightning speed for academics, but that lightning speed is critical to impact policy because we need to be able to get those reports in the hands of legislative staff and legislators before they have hearings on the bills, which typically happen mid to late April through May. And I do this work and enjoy it very much because I know we have a direct impact on the legislative process. We know the staff read the reports and summarize them for the members. We know that advocates, both for and against, use them. And then if a bill makes it out of the legislature, the governor's office also uses our work. So for me, it's just, it's been a great opportunity to be a bridge between academia and policymakers. Beth, I think let's stop here and take questions. I think we have a few in the chat. Should we just take them in order, do you think?
Great. I was thinking maybe we'll each take a question that we feel like we can answer and then
okay.
From there.
Okay. All right. So you want to choose one?
Sure. So the first question I see is, do you ever use Ballotpedia? And if yes, how credible is the website? I will say yes, I do use it particularly for ballot initiatives. I don't use it really for much else, although I know that they do have resources beyond just ballot initiatives, but that is where I have found it to be most helpful. And as far as, I just want to mention one thing. So we do have Ami Alden from UCSF Government Relations, who's going to be coming in a later session. But just to say, there are very particularly strict rules around getting involved in ballot initiatives. As a UC employee, UC is not allowed to take any positions on ballot initiatives. So more to come on that with Ami's talk, but I do want to acknowledge that if we're talking about ballot initiatives. And so then thinking about Ballotpedia, I do like it as a resource. I think it's pretty credible in the sense that most of what it gives you is actually factual information in terms of the background sort of, and then actually showing you who's in support and who's in opposition, which I find really helpful. It's not necessarily going to give you a recommendation on how to vote in the way that some other groups might. I think the League of Women Voters is also a really helpful resource. They put together a lot about ballot initiatives too, and sort of share both sides, but then also do make some recommendations. What I do for ballot initiatives is I'm often looking at multiple different resources. Both from supporters and opponents, so I can hear the arguments on both sides. I often look at op-eds, and I do often look at Ballotpedia and League of Women Voters too.
Okay, thanks, Beth. I will take, that's it. Why don't I take this question? Where are state rules published? And the answer is there is the California Code of Regulations that's where you will find regulations that have already been issued. In terms of proposed regulations, they're at that Office of Administrative Law website that we shared.
Great. And next question I'll take is, will you talk about lobbyists? They also influence legislators, their staffs, bill text, bill process. Absolutely, definitely. Lobbyists are sort of I would say a subset of advocates who are representing specific interests and paid to do so. They do have to register, so you can look them up and sort of see what their official roles are. Of course, yes, they do influence the process. I think this gets at the broader question of sometimes what's underlying this question is also like, can I really make a difference when the process is so influenced by people who are paid to be there full time, to really understand the process and to be there and to influence things, oftentimes part of organizations that are also making campaign contributions at the same time, and partly exert their influence that way as well. And so I do think that's something we're up against that makes things particularly challenging at the federal level, but also at the state level and to a certain degree at the local level. But at the same time, I would say that sometimes the danger is in believing that you can't have an influence because of all the various lobbyists that are out there. And what I would say is that in coalition, oftentimes people who work in the government are so refreshed to hear from people who actually have expertise or have lived experience with whatever the issue is. And sometimes what happens is that if nobody else is involved, then the lobbyists are the ones who get to determine everything. But if other people are involved as well, that's how you start to tamp down some of the lobbyist influence as well. So I won't say that it's not an influence. Of course, it's an influence and something we're up against, but I will say I have many examples of medical students, residents, and other folks in the UCSF community who have really impacted the policy process because they believe they can, and they get involved and they get in coalition with other people. So I'll pause there on that one and turn it over to you, Janet.
Yeah, so just one quick addition there is that I think that some of that success has come by students aligning themselves with groups like the California Medical Association,
Absolutely.
for example, that have professional lobbyists and can bring that skill set to the table, that skill set, those expertise, those resources to the table with medical students. So now powerful interests, of course, are always looking out for themselves, but where there is alignment with those powerful interests that have lobbyist resources, that can be helpful.
Yeah.
Let me see, I'll take the question. Do those figures from the California fiscal year 2021-22 budget include emergency COVID funding? So what you saw on the graph is just the state funding, the emergency COVID funding that came from the feds, which I think is what you're asking for, would be part of that 198 million over on the side that we didn't put on the graph. I mean, it's certainly part of the budget. My point was just to kind of show of those dollars the state has complete discretion over. Here's how that shook out.
Great. So I'll take the next question around when looking at a proposed bill, why will there be many co-sponsors, but yet the bill hasn't made much movement? Like more people will continue to sponsor the bill at different points, but yet the bill hasn't been voted on. So I think this refers primarily to the federal level. Certainly it can happen at other levels too, but in the local and state level, things do tend to move a lot more. It doesn't mean everything gets through, and definitely not everything should get through. But at the federal level, you just have such a very small proportion of bills that are making their way through the process. And what this has often now resulted in is basically large packages of bills or large packages of issues that are put together in one bill that is often supported by the leadership or by the president. And why is it so challenging? Well, there's a lot to say about that, but I think part of it is, as we alluded to earlier, definitely some influence from lobbyists, but I think a lot of it is also the filibuster in the Senate, the fact that it's just so hard to move anything through that particular step that then when the whole process becomes so challenging, then the incentive for the House committees to really do all of the work to move things along, only to have it really so often die with the filibuster, I think certainly plays a role in that. Also, just to say, there are a lot of members of the House of Representatives. So just because you have a fair number of co-sponsors doesn't necessarily mean that something is going to get through, partly just because you could have 80 co-sponsors and there's still over 400 members. So, that doesn't necessarily mean that you have a majority support. Oftentimes, I think people are now using co-sponsorship partly to show that they care about an issue, because it's so hard to actually say, oh, I passed this legislation at a federal level. When you go back to your constituents, you can say, like, these are issues I really care about, I co-sponsored it, etc. But I think it certainly points to some of the problems with how things are operating at a federal level right now and how challenging it is to make an impact. I don't know if you have any other thoughts on that, Janet.
No, I think that's all well said, and and I think just to reiterate what I brought up earlier about the California budget, we used to be in a very, very bad place. I would go visit folks in other parts of the country, like, what the, and people say, what the heck is wrong with you?
Yeah.
Well, part of what changed for us is by going from 2/3 majority to simple majority. And now some folks say, well, we really should have super majorities. We should have super majorities signing off on decisions. But I think the reality, what we used to see here and what we saw, what we continue to see at the federal level is how filibuster or 2/3 majorities really stymie progress. Mm-hmm. Okay, let's see, next question. Someone made, I think, an important comment about how it actually works. I mean, I want to emphasize that for this webinar, this is to really be sort of a 101 on how the process works, the building blocks. Now, and I think we've alluded in a couple cases of how the process in practice doesn't work as it does in theory. And certainly when it comes to making, final decisions on legislation, there are still plenty of backroom deals, and there's certainly ways to generate pressure beyond what we've laid out as kind of the general steps. Don't want to deny that. Just saying that our purpose here, is to lay out the basic process. Someone also, let's see, we got, I think I'll, since we're almost at time, maybe Beth, I'll kick this one to you. The question is how to generate pressure. How do you get legislators, regulators, judiciary to act?
Yeah, I mean, I think there's a lot of different ways that you can do that. I think the first and most important thing I always tell people is to be part of some form of a coalition that's working on an issue. You cannot do this work alone, partly because it'll burn you out if you try to do it alone. And there's a lot of joy that comes in being in community with people. But then also, of course, like the system is not responsive to one person, nor should it necessarily be. And certainly having, if you have research that's very influential, that can make you a pretty powerful person to come and bring that lens. If you have lived experience, that can make you a powerful person as well. But it's never going to be you alone in the way that we're oftentimes used to in academia. And so really thinking about how do you build your coalition, and then once you have that, I think it's a combination of things. So it's sometimes working with the media can be helpful. We'll have Molly Ann Brody coming next time to talk about how to work with journalists, and I think that can be a really important place. I think it's a combination of stories and lived experience and data together that oftentimes is the most compelling. And so having people in your coalition that can share both of those. And then the work can certainly be long, but continuing it, as I've shared, there's certainly been losses, and you come back again with other ideas. I do think, we've talked about the role of lobbyists. I do think if you can find an organization where you feel values aligned that has a professional lobbyist or advocate, that can be really helpful, because we all have busy other lives. And obviously you want to think about the values alignment there, but I think if you can find that, it's really, really helpful to guide you in that process. I think there's a lot more that can be said, and I agree. We definitely want to, it's a 101. So I do want to wrap up and thank everyone, but also we'll say there is much more to come. We started off the series with really a 101 and including our particular experiences, since we know that we share a background with many people who are listening here, but also important that we are going to hear from additional folks who really do this work full time. And there'll be more to come in the fall as well, beyond the initial speakers that we've outlined for the spring. So thank you, everyone. Thank you for your questions. Thank you for your interest and participation.
Yes, thank you very much, everyone. We look forward to seeing you at the April webinar with Molly Ann Brody.